you.
Thank you. Quickly, less than a minute, please.
Thank you. My name is Augustine Rostanjo from Bear University, Science and Technology. I have two questions concerning medical engineer, about medical engineer. So my question goes to the equipment that deals with the climate change that have been introduced. The police and the clarification from TMDA, they have put the standard from ISO, from WEDI standard, but they didn't put our standard because it is our developing country. But we didn't need the WEDI standard. So how the Ministry of Health could help us to to introduce to our country, because there is different things that we have, because we talk waste management, there are electronic waste management they can use to put in furniture, so we can use waste to produce a furniture. So how the Ministry of Health can help us to introduce this?
Thank you very much. I miss it there. I think there's no more hand from this side. This side.
Okay, so my name is Hamisi Msagama. I work with One Year Society in Tanzania. So nitaelekeza swali moja kwa moja kwa Dr. Ntuli na sio swali kama ombi. Mmesema ni vizuri tukaengage a wider community kwenye climate na afya. So ni ombi kwamba tukitoka hapa sisi kama vijana ambao tunafanya kazi kwenye afya na kwenye climate tuweze kukaa na kuweza kuona namna gani tuna design kampeni ya kitaifa ya kuweza kuelimisha jamii zetu mabadiliko ya tabia ya nchi pamoja na madhara yake kwenye afya, na tuje kwenye ofisi yako na Madam Florence Temu tupokee, tuje na hii proposal muweze kutusupport tuifanye hii kampeni sisi kama vijana. Asante.
Shiri ombi limefika, ametumia nafasi vizuri. Okay, the final hand from this side, tutachukua moja tu alafu tutaenda huko.
Kwa majina naitwa Engineer Lydia Haule na mimi natoka kampuni inaitwa ECN Recyclers, na kama champion wa recycling na mambo ya mazingira, kwanza ningependa kuwa encourage vijana kwamba msikate tamaa. Najua mna innovate a lot of things with technology because that's what you use mostly. But try to look where the country is going, because we're always told to go with where the vision of the country goes. So kuwa encourage ni kwamba kuna vitu mnafanya vizuri na mimi nafanya sana kazi na vijana. Kwa adults ningeomba ni wa encourage participate kwenye beach cleanups. Mara nyingi tunafanya kazi na vijana. Mkiparticipate kwenye beach cleanups mtaelewa Dr. John George alichokuwa anasema. Tabia inaanza na sisi. Hatuhitaji donors watusaidie. We need to change as human beings. Charity begins at home. We don't need money, we need behavior change. And behavior change is supporting what the local initiatives that we do. So as part of our organization, one of the strategies, this is my CSR that I do from my own company, is to teach students from high school, and I've taken private school, where we teach environmental club and teach them about awareness of environmental science. That is one entity. The another entity, maybe just to help Dr. Ntuli, I know people were challenging you that about you have the policy. Yes, the policy is there. It has not been integrated to the hospitals, and one of the strategies that Muimbili has started, they have hired me as a consultant to incorporate waste management policy to change it into the SOPs and change the waste management process. So to answer the doctor from Mkapa Hospital, Benjamin Mkapa Hospital, that is a very good point what he was saying. Most of the healthcare workers, they do not have the awareness. It's not incorporated into the structure of joining work. So what we're trying to do as a pilot project, we're going to work with Muimbili National Hospital, and we've been training block managers. They have been calling me as a consultant to train the block managers on the waste management, because that is actually a big challenge. Asanteni san.
Thank you. We are off to this side. Yes, quickly, and then we'll wind up with our panels.
Thank you at last. Congratulations, organizers. This has been a very interesting topic, but also a forum. I typed my comments, rather recommendations. First, after discussions of all the challenges, I see that it's high time for integration. Both government interventions, but also the NCA's interventions, because we are supporting the government. So we are not to point fingers to the government, but we have to support the government. So if we go with integration of services, or that will be with we have. The second one is tailoring our interventions based on the nature of the community. Okay, so based on how we implement our projects, we have seen that not one shoe fits all. So wherever you go, you have to go tailoring your interventions based on the community needs and the community behavior. And this also goes to the AHED. I have a question for the AHED. AHED, is it AHED? Eh? Okay, so I've seen your interventions, your activities. I'm just curious of how you are implementing your model, because it will be very good to be scaled up if it's feasible and if it's robust based on the nature of the community that we have. And also to challenge you guys that change starts with me, and you as youth have shown the way, you have paved the way, but we can encourage our communities, the neighborhoods that we have. We can start there with our projects there without funding. Yeah, thank you.
Thank you very much. One from this side. If there is no, I know we have seated for long. Can we just stand quickly, and then our panelists will. Can you just stand up? I know we have been sitting for all the time. Just stand up, but don't walk outside. We stretch. I'm not a physiotherapist, unfortunately. You'll forgive me. Tunaanza nini? Ni mikono juu. Ndio tulikuwa tunafanya shuleni. Mikono juu, kunja, kando, kunja, juu, chini. Thank you. Nilikuwa kaka mkuu by the way shuleni. Ndio ninachoweza kukumbuka. Thank you very much. This has really been exciting, and thanks to all amazing contributions. We know there are some of you who don't like to appear speaking in public, but you have amazing ideas. So after they have winded up, we have more time with this room. We have like 1 hour more in this room. We'll have 3 groups for those interested. One on this side will be on policy and practice. One will be on healthcare workers, and one will be on community and youth. So if you're interested with policy and practice, you remain on this side. There are a set of questions, just standardized questions, but you can put more points, just like for 20 minutes, and then each group will present like what they want for us to take as actions and recommendations to the state actors. So we'll have recommendations for policy and practice, recommendations for healthcare workers, like strengthening healthcare workers on the issues of climate and health, and then youth and communities. So those are the 3 areas you have identified. However, you can manipulate it as much as you want to add on. I know Dr. Mush will want to do on private sector and stuff, because that is one of his good areas of interest. And maybe to add on the question that has been asked, I also work with African Leaders Malaria Alliance as a technical lead for private sector engagement. And one of the stuff we are bringing to Tanzania is climate change and health data. Someone asked about TMA, meteorological data and climate data. So we are building up a scorecard tool. It's already there. We have for nutrition, malaria, and NPDs, RMSH. So we are building those existing scorecards to integrate the climate data and make sense of how climate change is affecting the healthcare system. So that day, that scorecard tool, it's going to be presented to the heads of state, because ALMA is a heads of state initiative or alliance. So one scorecard is continental. It will have all countries, and then it will show the indicators that are climate and health related. So at the Heads of State Summit starting next year, one of the key decisions we intend to have is on the impact, addressing the impact of climate change and health. And then for the country scorecards, they'll be used by the ministries of health, and then we are designing the multi-sectoral scorecards, each ministry to have a scorecard that will measure how much it's contributing to climate change and health. So we are still on early stages, and soon we'll be working closely to Dr. Ntule and the team to have that actualized, and Tanzania being one of our biggest priorities. I know Dr. Mushi has succeeded to have End Malaria Council here. The End Malaria Council has succeeded to have multi-sectoral approaches, and we are building on those successes to have more in Tanzania. Over to my amazing panelists. Mtanisame, this might have been the most tiring session you have seated on since you came to Chess, and this is the last time I'm going to call you to respond. Thank you. We'll start with Dr.
Not
Ntule.
really. For me, this is quite very exciting, and I must say that I feel so much energized by the people, the way the people they ask questions, but the questions they do ask, they are very relevant to this agenda. And I must commend AMA. I attended their meeting last week in New York, and they have a lot of strategies to implement, including the scorecard. And I'm sure that will help us to make timely decisions at the national, sub-nation, and at the local government level. And I also must thank my sister over there. She commented on the issue of complimenting on the government efforts. And I said yesterday, private sector contribution to our healthcare industry is up to 40%, and it varies across the country. In Dar es Salaam, it is more than 70%. You go in Mwanza, more than 70%. And again, I must say, change starts with us, and change starts with me. Maybe a bit to respond to an engineer's comment. I must say we take up all these comments, that we need to make sure that we translate some of the policies. But with regard to the waste management, especially in the hospital setting, we have had a number of guidelines. Hazardous waste, non-hazardous waste. So we have a number of guidelines. But again, I must tell you, one of the challenges is implementation. That's why we are thinking maybe we should come up with a campaign, sort of. We have learned from previous campaigns which we have had that they help to change people's behavior. Maybe with this one can also help change. There's these boxes when you go to the hospital for sharp boxes, and you find the syringe is there, not in the box. So you start wondering whether this person haven't attended any sort of training or haven't read NSOP. And with regard to having this conversation and also having diversified group, I'll use my status of being a member of Tanzania Health Summit, board member for 8 years now, to try to convince my colleagues. This is what we've been doing. Whenever we visit these type of platforms or panels, we get also issues that seem to be of relevance. So next year, let's be assured that we will have people from Prime Minister's office, we will have people from all the sectors that are responsible with the climate. So I can assure you that next year we will do that one. And there was this the issue to do with TMDA, and now we have the donation guideline. You are not allowed to just give us whatever equipment or to give us whatever assistance without abiding to the donation guideline. I think it was in 2010 when we received a donation of X-ray machines, only to realize later that it was emitting X-rays. So we had to quickly try to return it, but it wasn't easy. So from there then is when we came up with this guideline, and just to safeguard our health. And Judith, you spoke on meteorological data. We work very close nowadays with the agency and ensuring that we take up their forecasting data and incorporate into our plans. And it has been working very well. It was last year when they issued the warning for El Nino, we had a contingency plan. And this contingency plan emanated from the meteorological agency. And we were able to implement it in some areas where they experienced torrential rainfalls and extreme weather conditions. And there was this issue to do with education, whether this is incorporated into the curriculum. Last year, the Ministry of Education revised their education policy, and they have also incorporated the issue of climate change into their policy. But also they are working and ensuring that all the curriculum, they are having the climate agenda. So how did I know?